Good morning, everyone. We're going to reopen our emergency meeting that we've left open. We do have people on the phone. If you would please keep your telephone on mute until you're speaking would be appreciated. So why we
Have them introduce themselves.
we can give it a shot. The people on the phone, would you like to introduce yourself? I'm trying to think the best way to do that. They're all county employees, I believe. Road department, are you on the phone?
On the phone.
Okay, I heard several others. I don't know what departments aren't here. Let's take a shot. Anybody else on the phone, introduce yourself?
This is Nikki from the business office. I tried to do meeting online, go to meeting, but it's not picking it up, so I'm on the phone with you.
Okay, thank you.
Marla from the DA's office.
Thank you. Anybody else? Okay, so we're going to start off with basically a staff meeting. There's a handout. I think everybody got that. The Board of Commissioners, and a lot of this is fluid. Things will change almost as fast as we talk about it. But right now, we said we come back on, microphones aren't working. Oh, there it is. Got to turn it on. That we come back on Friday and let everybody know if we're going to shut down longer. The Board of Commissioners feel like it's another week, and we'll do it weekly. And so it'll be the same as what we're doing now. So with that said, before we have presentations, we have OEM here, and hopefully Judy will get here maybe for an update.
Just here.
But there's Judy. Welcome, Judy. So we put together a operational plan, rough. It's just what it is. So the courthouse is to continue to be limited access, shut down to the public. Same as what we've been doing for this next week. We're doing this a week at a time. There's some uniqueness to that. I can't thank the department heads and elected officials enough for keeping things going remotely, by telephone, by whatever it is. Looking back at Stacy, business has to go on for deeds and all that kind of stuff. And with the treasurer's office and so on states here. As you have your uniqueness, get it to one of us commissioners or whatever, and we will, like I said, this is changing almost hourly. Thank you for getting the time-sensitive documents out there. Operations will be essential to employees or modified duties, i.e. other departments as needed. I sort of look at this, almost everybody's an essential employee, myself. Some of them aren't needed where they're up here at the courthouse particularly, but they may be needed someplace else. So we will be seeing employees maybe helping out another department, maybe helping out OEM or whatever. There's nothing normal about this whole operation right now. Keep that in mind as you have employees. You got to keep your department running at a level. If you have an employee that they're getting paid and they can help out another department and they're not at risk, they don't believe and everything, let's help each other out. If you're sick, use sick leave. If you're not sick, it's an honor system. Then we're paying you, but you have to be available. That employee needs to be available within 20 minutes during normal operation time. So there's that. There is, and we'll have a presentation here in a little bit, there is some uniqueness to sick leave that's coming down from the federal side, down to the state side, to requirements or things that we're going to be able to do or not do, and our employees are going to be able to take advantage of. We don't fully understand it at this point, so we're going with the way we're talking right now, and as that materializes, we'll adjust everybody to what's the appropriate thing to do for our employees. Department heads and elected officials will make decisions on their department operations. That's the way the Board of Commissioners been the whole time. The commissioners may make suggestions or give direction for department operations as things change almost hourly or daily. And so we don't intend to get in the middle of department or elected officials' departments. But this is not normal. There's nothing normal about this. We may have to make decisions that you guys might not fully support, but we want to have that conversation. You know, it's one of those things. We don't intend on doing that, but we don't know how long this is going to go on or what the uniqueness is going to be. So, commissioners, that's sort of going a fast level at this.
Yeah, I think honestly, one of the big things for me is the non-essential employees, which is kind of a strange way to phrase it in our draft, but it's true. The people that aren't here, we need to make sure that they're available within 20 minutes to half hour, being able to get back in here if we need help and we need additional staff for whatever purposes that might be.
Okay, so on the phone, whoever's not muted, would you please do that? And so being we're talking sick leave and this part of it, I'd like to have Jay come up and give an overview of his understanding of the order come down from Congress, the president's side on sick leave.
All right, so the president signed into law the Families First Coronavirus Response Act. Basically, nothing changes currently until April 2nd, but it's about a couple weeks away. So right now, if you're sick, stay home. It's sick leave. If you've been asked to stay home to help not transmit this disease and not come into contact with people, it's paid administrative leave. But you need to be available to come to work. You're on the clock, you need to be able to respond within 20 minutes.
During work hours.
Right, well, just like the commissioners just explained, but beginning April 2nd, everyone will be entitled to 10 days of paid sick leave, no matter what, whether you have sick leave in your bank or not, and it's my understanding that that won't be deducted from your sick bank.
So that's 80 hours of paid additional sick leave.
Mhm.
That's what Congressman Norman just said.
Right.
Yeah, okay.
Yeah, and then there's a piece to that too, that, you know, beyond that, if an employee doesn't have those hours in their bank, the employer's still gonna be responsible to pay them 2/3 of their annual pay. And this is gonna go on through December 31st. It's not just, if it's COVID-19 related.
That's the key word. It's got to be COVID-19 related. That's why Congress did it also.
So-
Right.
The Secretary of Labor will issue more guidelines between now and April 2nd, so we'll understand it better exactly how this is going to roll out. But there is also a school closure piece to this, that basically anybody who has kids that are staying home will have the right to stay home for 10 days, the first 10 days paid. After that, it's not
What was that,
paid.
Jan? Is that
Pardon?
the first 10 days of what?
Is the microphone working?
Yeah, you might want to switch your microphone on. No, it's not.
Where is it?
There you go.
So if you need to stay home with a child who, because of a school closure, they don't have to be sick, they don't have to have the symptoms, but if they are sent home because of a school closure, these employees, beginning April 2nd, will have the right to stay home, care for those children
Mhm.
with full pay for up to 2 weeks, 80 hours. So that's going to be interesting. I think we're going to see more guidelines of how to roll this out in the next 2 weeks before April 2nd. Because that could present a real hardship on some of these smaller businesses. Basically, the bottom line though is, except for in the case of the school closure, employees are going to be entitled to 80 hours of paid leave without affecting their sick bank beginning April 2nd.
And I would like to sort of add to that. The intentions of the Board of Commissioners is to keep the least impact to our employees that we can. We had already pretty much agreed to almost exactly what's going on there in a sense. I don't believe Lake County employees will abuse anything. They'll use what's appropriate. And so I can't say enough of our employees and how they're reacting under this right now. They're doing this very well. So I would like to open it up to questions. I done a real fast overview of this. I'd like to open it up to questions if if there's anything that's not really working with this last week, or the way the courthouse is operating, or our landfill, or our annex, or our road department, if there's some uniqueness that the commissioners aren't aware of and you need some help, if you have some questions right now, it's a good time to ask if anybody's got any questions, or if they have any suggestions. It's not only questions, it's suggestions. And I didn't say fairgrounds, because that's another one also.
I have a question.
Yes,
If you're gonna continue to keep the building closed to the public, how do you guys feel about, say, someone calls my office and wants to get a marriage license? Making appointments for those people and meeting them at the door like we are with deliveries right now, and letting them in and then escorting them back out when we're done?
If you
I haven't had anybody ask, but
If you let them in, I think they need to go through the screening process.
yeah, we have our own type of screen thing, Melanie has, and we've done that with one person so far,
okay.
probably maybe more. But we have to keep business going at a level. I guess I'd look at our public health official here, is our screening that we do goes on honesty. People have to say if
Well,
they,
people have made their way into their doctor's office saying they're negative for everything, and then they're copying in, by the way, I've had a sore throat for a week.
Yeah.
So desperate people will do desperate things. People
Yeah.
are gonna be taking Tylenol and ibuprofen who feel like they can't miss work so that they don't show they have a temperature. We know that's gonna happen. If they're calling in, I would screen them over the phone so you don't waste your time.
Okay.
And then that way you know if they can come in or not. I
Right.
think that would be a good idea. So I wanna go on to say, somebody needs to let me in the club, you're locking me out, so put that on the note
Yeah.
somewhere, that Judy's allowed in this group. So I'm not calling people, please let me in.
did you fill out your form before you came in?
I get a green light and it's like fake, so, somebody on that. No, I think. I think that's totally appropriate, that's what we're doing.
Okay.
The more that we can do to enable our county to have access to us when it's important to them, the better we are. We have a new way that we're gonna do information, get it out to people, so I feel it's gonna be much better. So information's gonna go quicker out to people, and we got that straightened out last night. And any questions, please ask me.
I have a question.
Uh-huh.
And this
So, people on the phone, are you hearing everything that's being asked or said?
Yeah.
Okay, go ahead.
maybe they need to ask, do they need to ask a question before I ask you?
No, go ahead.
So Congressman Walden asked if we would ask our public health people if they could give us an inventory of our PPEs.
So I've gathered that, I have that information. I got a call, I just got a text saying a Tanner, a senator's office wanted to talk to me. Do you think what that's about?
Was it a state or
Yeah, it was
Yeah.
a state person.
state? We haven't
I don't.
had a conference call with
Okay.
the state.
So I'll figure out what that's about. But yes, we can do that. And then what do I do with that information?
You can give it to one of us and we can,
Okay.
or Mel, and we'll forward that on to the congressman.
So is that
Because
just
what the-
public health? Or tell me the
No, I'm
hospital,
talking,
EMT?
I'm talking what we have for PPEs in Lake County.
Okay,
Because the Oregon Health Authority, what they've received and what they put out are two different stories, so he's trying to figure out what's
we've
going on.
asked for some and I don't know what we're gonna be getting. There's no, it's you're allotted this amount, but no if you're gonna get it or not.
Well, can you let us know
Yeah.
what we are allotted to?
Yeah,
And then what
I have
we
that.
get, because I need to know this so we can stick to congressman on it.
Yeah.
We need to kind of find out what the indiscrepancies are that the congressman is finding.
Okay,
They're like shipping 9,000 or something, but the hospital that the congressman's talking to is like, well, that's strange, only 3,000 showed up.
I think I can shed a little light on probably their confusion at that level.
Okay.
Because we went out and trying to see what we need for PPE. And we as a county, since we're nice and small, it's easy to get a hold of all our fire departments, EMS folks. And we put that order in, include police, fire, EMS. But however, I'm seeing emails coming from the fire marshal's office side of the house saying we've secured PPE for all your fire folks. So that's adding an inventory problem because I've placed that order again. Now fire guys are got an order and supposedly they have some stuff coming to the fire department. So now we've kind of like double numbered what we need.
Well, that might be really.
So that's gonna become a huge issue. This goes
Okay.
on.
So we, this triggered one of my thoughts. We do have a public information officer now, the Board of Commissioners has appointed Melanie as a public information officer. So we can sort of bring things to one place so that we can get this information to and from. So, that's her actual designation right now. She's doing her other duties. If it becomes too much to do both, we will keep her as a public information officer and backfill from some other departments to do minutes and things for the Board of Commissioners. So we're trying to, the Board of Commissioners and OEM and everything, narrow things down so that we're not all doubling over on everything. So I just wanted to make sure on that. And I'm gonna ask for an update from both of you eventually, but I wanna make sure on county operations, courthouse and departments, is there any other questions from our staff, department heads, elected officials on day-to-day operations as we're doing this weekly right now?
Or maybe not even questions, maybe you guys have
Suggestions,
ideas that you think would work.
Commissioner?
Yes,
This is Ken, and I just want to give an update, on the EMS building. I've been in contact, that
okay,
they can use it. There's been some temporary occupancy. So that's just the update
perfect.
on the building.
Thank you.
Ken.
I've also been in touch with, State Fire Marshal Scott Rice, and, the information he's given me, he's been told, from the state, I believe he's out delivering, they're having him deliver some, PPE around the county. Where, I don't know all the logistics spots. But he said that is kind of what he's doing as of now.
That's good news. Thank you.
Well,
This is Amy from the library. Hello, everyone.
Good morning.
Good morning.
I just am wondering about getting our deposits made and our accounts payable turned in, since we're kind of over here and we don't have access to the building. I'm not sure what the process is to do that.
Okay, we have our treasurer here. Do you have a thought on that?
They, just call and then I'll meet them at the door.
Did you hear that, Amy?
Yeah, I did. I just wasn't sure if they were, because I came in a little late to the meeting, so I wasn't sure if they were gonna be in the office and able for us to call and do that. We can do that just fine.
Perfect.
Excellent.
Thank you. Other questions or suggestions?
From the assessor's office, most of the counties in the state are still operating on a closed campus operation. We got personal property returns, we're due the 15th, we got a mountain of those things. Our appraisers have been out in the field gathering up data. We've been waiting to get some valuation material through our new software. We just got that done. My appraisers have at least 30 days worth of work they could do at their desk and never darken a door. And I'm suggesting that we can go ahead and allow I asked and we were deemed non-essential, but I would like to see if I could get my staff to come back. If they're healthy work, we can kind of separate them apart so everybody has their distance and so on, to go ahead and continue business. I had a lot of work to do. I've been spending most of my time on the phone. Title companies are still going, properties are still changing hands, a lot of things are still happening. I believe that our office can operate by email and phone just fine, so.
And I'll speak for me and probably the whole board is, your operations, absolutely, Dave, if that's what you need for your operations, as long as your employees are healthy and
Correct.
pass the screening, do the screening every day, and
So what you're saying is when they come to work, they need to go through a screening before they come to the
we
workplace?
have a form
Just
for
the
you
form
to
is-
do every day.
That form, okay.
Yeah, Melanie has the form, and then you just do the checklist and that.
All right.
And, make sure that your employees are comfortable with being at work.
Okay.
Okay. Did you guys have anything different than that? Okay. Other questions or suggestions?
So, I know at the hospital today, we are running low on manpower to operate outside, to operate the traffic, the parking. And if you have staff that would be willing to lend a helping hand, we're gonna contact, college kids who are home, but they'll be home for 2 weeks. And then I'm hearing it's gonna be all online, so they might go back to wherever their college is, they might stay here, I'm not sure. But we are definitely needing some manpower down there, especially over the weekend. A lot of us are on day number, I don't even know, 9 of working every day, and that can only go on so long. So we're scrambling, and if you guys have anybody that would be willing to come work with us, we would love that.
Great suggestion, and that falls right into our request to Congressman Walden
Right.
for the federal staff to be able to be leveraged for these type of things. That would fall right into place, so, all the department heads are here, and, your request, if they have somebody that's available, and
Yep, if you have somebody available, it's Arvinder Singh is the person you contact at the hospital. You can call me first and I can give you contact information. He's the one organizing and running that. Doesn't have to be a medical person. And they are, our MAs are getting worked really, really hard. So we're gonna try to have one MA doing vitals and one non-medical person to help just for security and to have 2 people there. So we're, now that the initial week's over, we're trying to reevaluate and give some of our staff a break. And any help that we can get with that would be greatly appreciated.
so I have a thought outside of government employees. If those positions are a paid position or would get paid, then maybe some of our restaurants or other businesses that their employees are not working
Correct?
would be a great opportunity.
Yep.
So is it a paid position?
I believe that they're going to try to make it a paid position for the manpower that we need, with the thought that hopefully we will get money to reimburse all this at
I
some point in
think you
time
will.
for the hospital's sake.
It might be worth it to put that through the JIC and through,
Yeah.
and out to the public to look for people that are needing some extra work. It's not a request for volunteers, if it's paid,
Right,
so
right.
honestly, I think it would be.
I'm just gonna have to coordinate through their instant command system at the hospital, because they're gonna have to deal with the influx of these people.
Mhm.
And then it's gonna affect their finance for tracking that, we just need to make
Right.
sure it's all plugged in.
It has to
together.
go through HR.
I would love to see some people that's not getting paid right now have an opportunity, is what I'm saying.
So we'll chat more.
Perfect. Other thoughts or questions?
The message was made the other day at the meeting by Judy, separating staff, shift kind of work. We're looking at going towards that in my departments. So half a day in the afternoon and half a day in the morning, I may have staff available to
Okay,
help out.
that would be great.
Our first go-to is gonna be helping the sheriff's office out, Mike and Daniel. So I'll get with these 2 and figure out how we can help them out.
Perfect,
And then I'll lead out to you as soon as we're done with that.
that'd be great.
Same thing with juvenile, have one on in the morning, one in the afternoon kind of thing, so we'll have some things,
Perfect.
Okay.
some
So,
staff available. some
any,
resources.
any other questions or comments? I'm gonna go have some presentations real fast. Amy, the state, are we gonna see anything where we're gonna be mandated to keep the door open for you guys at the state level or anything? How are you guys gonna continue to operate?
For the next week, we're gonna continue the same as you guys, just exactly what we're doing right now. We're open from late 8 to 11:45. And we do the screening process. If there's an absolute mandate that they need to go upstairs, we let them in that way. Next Tuesday, we're expecting to get a new order from the Chief Justice that sort of dictates how we're gonna move forward in business there. And so once we get that, then I'll update you guys. But as of right now, it's just sort of business as usual for the last week.
So we could see it having to make a different access here at some point
Yeah.
as far as the courthouse goes, depending on the state's direction.
Yeah.
Okay.
And so as soon as I know that, I'll update.
Could I just could I just make a request that when presiding judge, Judge Vandenberg sends out memos to the attorneys and things, that we get that as well, so we know the court operations and what's happening, in case we have contact with clients, one, they have warrants, so we can get them cited, or two, we can work with law enforcement on how to get them cited, because right now we don't know what's going on.
Yeah, I can get you a copy of the PT order.
Thank you.
Okay. So with that, I'm going to ask, was there any other questions of Amy? I'm sorry. No. Judy, I think we're all awaiting our public health professional update and things from your side.
So, trying to think.
Will you come up here, Judy?
Days blur, I'm trying to think if there's anything really new to tell you. Just the process is continuing, at the hospital, the way they're doing their screening to get in. I have a desk over there because I can't seem to get away, so I'll have a desk over there that the public health will have an extension that they can get a hold of me at this point in time. So I'll be working from there, for the next few weeks until whenever, I'm not sure. Like I said, Mel and I, in the hospital, we have a new way that we're gonna get out information. I ask anybody, if you see good information out there, please get it to me. I'll vet it and I'll share it. I think the more eyes out there that's finding good information, we can get that to our community. I'd like to see that happening. I'm in meetings most of the time, so I don't have time to sit and look. I'm finding, and that's a hardship. So I have some people working on that. Then I will be the one that gets to say yes or no, cutting out 3 or 4 people now that had to say yes to getting stuff in the newspaper and radio and mail. So it should be going much quicker for us. So I would appreciate any help if anybody sees anything that you think is important for our community, just let me know. Everything is going, I think, well. Daniel, anything you can think of from yesterday that oh, the reader boards are gonna go up. I'm not quite sure, who's doing that, do we know?
We're gonna work on that with Jake.
And then I'll get information that we'd like up on that to you.
So the
Is that
president
today?
built the boards and is bringing them to the loading dock at the hospital to drop off.
Okay, perfect. So we'll get reader boards up.
They'll be at Safeway, Dollar General, and the Chamber.
What about North Lake? Do we have anything going up there for information?
We need to.
Yeah.
Yes.
I got a
We
request
have
for.
Paisley, Summer Lake, Silver Lake, Fort Rock, and Crystal Valley.
We have a reader board out at the fairgrounds that should be utilized. Almost everybody sees that.
This is more of a poster board, not that we want people clamoring around these poster
Right.
boards, but we are gonna put information up for them.
If you need a reader board, get with Ronnie.
I think we need to do the same thing, we need to get a message on that, on the fairgrounds reader board, the fire department reader board, whatever other reader boards are.
There's one at KBE, if they would utilize it for
I
that.
think that's important to send out where we need to send the one site where our information is going, that's the hospital and the public health site. We just need to get those on those reader boards.
KBE in North Lake, you mean?
No, they
Does
have,
KBE in North Lake have one too?
I see the read board downtown, or Christmas Valley area, something like Fort Rock.
The closest thing to, any kind of a bulletin news board is probably the post office wall and stuff like that. That's pretty much what they mostly go off of.
We're working on posters to put up in like the stores and on Howard's, the place for seniors if they're out and about to try to find and be able to read. You guys are aware that Safeway has Tuesdays and Thursdays, I believe, from 7 to 9, shopping only for seniors or people who are compromised. And then Dollar General has daily from 8 to 9. I put a call into both of them yesterday. Safeway has a really nice system in place for cleaning and sanitary, and they have somebody devoted completely to that. I feel really comfortable with them. Dollar General, I contacted. I think they were a little overwhelmed. I sent Ariana down with some information and some guidelines, and then I'm gonna just go and visit them today to see. I think the difference is Dollar General doesn't have the staff like Safeway does, and we might need to get somebody in to help clean the carts and give assistance if we need to there, because that's very important to our doctors to make sure those carts get cleaned hourly. So we'll work on that. We're gonna open up, I have 114 flu shots at my hand when I gathered them all up from the community. And I'm gonna do a flu clinic on Thursday from 12 to 4, drive up, stay in your car at Public Health in Marius Building, and offering our elders a booster if they would like it. We don't do that because that's not recommended, but I think it would be helpful, and I also think it would make them feel better. And they're just gonna get thrown away in June if nobody takes them. So we're getting that in the newspaper and out to them. So if you know of anybody who would benefit from that, it's first come, first served. Thursday the 26th from noon to 4, send them our way.
What age group is that when you say elders?
Anybody can come get it, it's free. You don't even have to have your insurance card. You will have to fill out the paperwork for me so I can send it into the state, but we're not gonna question anybody. We're just gonna give it if people want it. Yeah. So we have that starting. We're meeting with the doctors frequently. The doctors are going to, I don't know if you guys saw, they posted a letter. Dr. Gallagher went on the radio. Every Monday, they're going to give me an update. If they want something in the newspaper or on the radio, they're going to bring it to me, and I will make sure that gets to where they want it to go. If there's anything before then, they will let me know, but we're going to start just getting information weekly from them. They may want something, they may not. They may get too busy that they don't have time. But for right now, I think it's important for our community to hear from our physicians. Our teenagers listen to me, but I don't know adults. They do, and I think it's important for them to be saying this and not just Judy Clark.
So Kevin, I think was gonna offer something back there.
Well, I had actually a question about the reader boards.
Uh-huh.
What kind of information were you gonna put on them?
Just the information about the coronavirus.
Okay, so
how to take
basic
care of yourself.
information.
Same thing that we're gonna put on social
Okay.
media, newspaper.
Okay,
Yep.
I was just wondering what you were gonna put on them.
Yep,
Okay.
that's, I believe is what we're gonna put on it. Nothing's firm yet, but I think that's the intention.
Is there a date yet when they're gonna go up, or?
He was saying he's thought that they're gonna get set up today and
It
then
should be up today.
Okay,
we'll
We'll be
figure
working
out.
on the noise
Yep,
and stuff, so that'll probably be tomorrow, I'm guessing.
yeah.
so Safeway, Dollar General, and the Chamber is what I heard.
And we want North Lake also.
And North Lake,
Central Lake,
We'll work on those.
we'll have,
which,
Further
you know, you're looking at Christmas Valley, Fort Rock, Silver Lake, Summer Lake, Paisley, you wanna get all those locations, so.
Flush and Adele.
Well, Flush and Adele, absolutely, in the Warner Valley, yes.
any more, Judy?
Nope, I think that's all I can think of.
Hey Judy,
Yes.
on information, when, everybody's asking me about do we have a confirmed case of the
So-
virus here?
So the deal with public health right now through the state is we are not allowed to say if we've tested, if we have any positives, if we have any negatives. We have to refer you to the CDC site that has updates twice a day. And I'm not exactly sure why that is that way, but we can say that we can test. We have supplies that we can send out tests, but I can't discuss if we test and what the results are. We can just refer you to the CDC site.
Sorry.
And it says it has it all lined up with who has a positive, who has a negative, counties that don't have any. And
Demographics are on there, age
Yeah.
groups is broken down by how many.
I had a chat with Jen this morning from the hospital about that, and she said something about HIPAA regulations.
Well, I do know that, that some of the counties, when they were first testing, somehow it got out who the person was that was positive, and it was unfortunate for their family. And people are going to hopefully not, I mean, people are afraid of this, so we don't want people knowing that Judy Clark has tested positive. Because a lot of us, the majority of us are gonna get it, and then we're gonna get better, and we have to then go in and I do patient care, and if you're saying I have it, what are the patients gonna think?
Yeah.
We have to have nurses, we have to have doctors, we have to have everybody, it's gonna pass through just like the flu, but it scares people, so I think a big portion of it is privacy, and so therefore HIPAA. I'm just
Yeah.
guessing that's why it is. I'm
That
not
was,
sure.
we had a long conversation about that this
Yeah.
morning
Yeah, I'm
on the
just
phone.
guessing. So that's what everything, and I have to say, the CDC site and the OHA site are fabulous. The 211 number you can call is great. They're gonna have a phone number at the hospital that's a hotline that when you call and have questions, they're gonna answer it. They also have the physical therapy department, of course, is down to seeing hardly anybody. So they are the ones that are gonna triage clients that are calling in, patients that are calling in with symptoms and telling them what to do moving forward. They're also the ones that are gonna do the daily callbacks, depending on what's going on. I'm really proud of them. They have a really good system in place. Is it gonna be tweaked every day a little bit until we get it running smooth? But I think we have a lot of good things going on.
Thank you.
Yeah, thank you for the question.
Judy, this is Amy on the phone at the library, and you kind of broke up when you were first answering your question, so I just want to clarify that what you said is that if we're concerned if there's cases in Lake County, we should go to the Oregon Health Authority website, and then is that information updated, like if a positive test were to happen, that would be updated to OHA within 24 hours?
I think OHA too, but I know CDC site for sure. The CDC site is where I'm referring people. And I think they have daily, I think the tests come back twice a day. They get the information and they post it to the site then.
Okay.
I think moving forward, if and when we get a positive case, they will contact me first. And then moving from there, I will not get contacted anymore. I just have to daily look at our lab site to get numbers moving forward.
Gotcha. Thank you.
Yeah.
And also, Judy, I know you're super busy, but sometime when you have time, if you could just call me for a few minutes, because we're thinking about starting some library takeout service, and I just wanted to talk through the mechanics of that with you at your convenience.
Okay, thank you.
Okay, thanks.
So before we let you off the hook, you're gonna be on the hook quite a
No
bit.
worries.
Would you say that Lake County as a whole is doing pretty good at the separation, the sanitation, and our people and our employees are doing pretty good to keep
Right.
this slowed down? Because
I
there's
think so, yeah.
positives of what's going on right now.
Right. I think, so two answers. One is I have not left the room for 9 days, so I haven't been out in the community to actually see it with my own eyes. But I know with the school, the courthouse, I know smaller businesses are the restaurants. I think we are doing our due diligence very, very well. I know that the physicians are concerned, they want more done. It's very, very important for them to have everybody stay home as much as they can. Of course, people have to come to work, but that's after you leave work, not socializing. Yeah, I think we have at our meetings reached out to a couple other counties. I think we're significantly ahead of a lot of people of what we're doing. And I think that is because of our physicians, and I think they are desperately trying to do the best they can for our community, and we should all, every person, talk to everybody daily that we come in contact with and reassure them the reason why they're staying home. It's not an instant thing that you see, and some of us are social creatures, so I think phone calls are really important to just check in with people so that they know they're doing the right thing by staying home.
Thank you for that, and I wanna add to that because of no real complaints, just there's been a concern as we've shut down and the understanding of essential staff and the ones that are staying home. We've had, or I have, I don't know if these other two have heard, a couple county employees that they're seeing around town quite a bit. So department heads, elected officials, if your employees are staying home, please ask them to not be socializing too much out there because of that does create a little bit of anxiety.
Well, and we're leading by example.
Yeah.
So I go home when I can go home. Sure, you have to go to the grocery store, and you have to go places, get there and get home. Keep 3 feet at least between you and the person that, if you can. Cover your cough. Take your temperature if you need to. And
Wash your hands.
yeah, wash your hands, wash your hands. It's basic kindergarten etiquette that we need to remember. We know, it's nothing new. We know how to do these things. Let's just do them, and that will help a lot.
Thank you so much.
You bet.
Daniel Tagg and Mr. Patterson, oh, I'm sorry, there's a question from Jake over here.
Just a quick question. Understanding California, governor has ordered a shelter in. Should Governor Brown order a shelter in, what does that look like for county operations as far as shelter in?
We will figure out that if that order comes down. In California, they started with, I think, the San Francisco area. And so it didn't affect the rural areas. And now they're reaching out further. I'm not gonna try to guess what her order would come down.
Yeah, we talked a little bit about that on the call this morning with the congressman, on trying to figure out how that is going to look differently with the rural communities. Obviously in the big cities, it makes a lot of sense, but you know, if you're already living out there where you're all alone, so.
Yeah, we're kind of already sheltered.
Lake County's been, sheltered for a long time. So. We've been the John Wayne of work. So it doesn't really make the same amount of sense that it would for like the metro area. So we don't know what that's gonna look like yet.
Sure. Good. Daniel and others.
Slide up here. Hey. Slide over. Bigger than you.
Hey, social distancing. It's like 19 of us in here, but you know.
People hear me. So we've got three functions of this whole thing. This is a public health emergency, so it's between public health and the hospital.
Move the microphone over, because we have people on the phone.
So we set up the instant command post to set up at the hospital. So that's kind of the main hub. We've also set up the Joint Information Center, which is Melanie's the lead on that. And then we've also activated our Emergency Operations Center. Most of that's by phone. We're doing an update every day. We were doing it at 1:30, we're now doing that at 2:30. We're discussing whether or not we'll discuss that new day at 2:30, whether we're gonna go on Saturday and Sunday through the weekend or just do an update Monday. But so that is going on. Ordering resources from the state is quite the challenge. Everyone's overwhelmed. We can't get nothing because it's such a huge issue. So I did mention the PPE issue coming from, you know, we put our stuff to public health. Now the fire service reached out to the fire department asking what they needed. So I really think that's gonna be something once it's all done, we need to sort out so we're not double ordering. Because it's critical to have good numbers right now.
Just on that deal, I wanna give you what Congressman said, that the US has shipped out just out of their own cash. It was 36 million respirators, 85 million masks, 16 million shields, 18 million gowns, and 48 million gloves.
And how that comes down to the state is
that-
where the.
that-
It's not going to Lake County.
How that gets reported is where the challenge is.
No, he said should be arriving in Oregon.
Yeah, it is coming
So
to
Oregon,
though.
this is for Oregon, all those numbers that I.
So we wanna make sure that we get at least some of that, you know, that it's not eaten up by just the metro area, but I know that they'll take a big portion.
Now, I
of that.
did get off the phone with Todd Forbes a couple hours ago, and his direction from way up above, they're kind of loosening up on some of their stuff as well, so.
I would predict that it's gonna get loosened up
Even more.
fairly
And
fast.
we've been poking the hornet's nest on that one.
If we had other commissioners across the state that would support us while we've been trying to get them. So the congressman heard it well, and our two senators have heard it all.
So I guess operations is the new norm. I like to say ops are normal, but the last couple days kind of nothing will change. We know there will be a change coming down the pipe, we just don't know when that changes, it's a wild guess at this moment.
Am I missing anybody that needs to give an update?
Quick update from the road department. Kevin, do you guys feel like you need anything out there? I know we talked last night, you know, you were mentioning that we may be possibly looking at another snow event on Monday.
We're just watching the weather to make sure that I got enough people on staff that if we do get a snow event, that we can clear it, you know, efficiently as possible. Some of the resources, though, for request, I guess, would be typical to everybody: hand sanitizer, sanitizer and some Lysol cleaning agents or things of that nature if we can't just simply acquire those at Safeway or somewhere, but I'm gonna go check on that here in a little bit.
Okay, and Dave Berman shaking his head in the back, I think he's been predicting on doing some orders, or he already has. Do we have any extra that?
Yeah,
we
but I've
can-
got some I can get out to him, hand sanitizer, some cleaning stuff.
Excellent.
So Dave will get some down to your department, Kevin.
Okay, thank you.
Yep.
Anybody else need to give any department or any update or any other questions? I guess I just can't thank everybody enough. As sitting here in leadership, as a county leadership, as a board, we as a board have probably gotten a little bit closer through this and thinking of our community, not ourselves. That comes from the heart. This is concerning for everybody. Whenever it does, and it will sometime come to Lake County, it's gonna affect one of us very seriously. It's gonna be somebody we know, it's gonna be maybe a family member. We need to be strong, we need to rely on each other and support each other very much on that. It's real, there's plenty of naysayers out there. We're doing good things, our doctors, public health, we're doing good things. So when you get wore down, try to take care of yourself, eat right, get the rest you can.
And let us know.
Everyone let us know. So, anyways, Judy, I do have one question.
Absolutely.
This is Brad, Bradism. Open up the windows and get fresh air, is that a good thing?
I have no idea, I haven't heard that. Nobody's around you, why, it would be wonderful to open up our windows for a while. I don't know, obviously if people are coughing, if you're in town and you have close neighbors, probably not. Changing your filters in your house, if you haven't done those for a few years, probably a good idea.
But most, like, a lot of recirculating air.
And that's what we
Is
were
in
thinking
these
about in
buildings.
this building, because if
I
someone has
haven't
it
heard
in jail,
anything, I
we're
haven't seen or heard anything about that. Something that I can look into, but
Maybe
I
it's
sure
something
haven't seen
simple
anything.
we're overlooking.
Yeah, I know that at the hospital they went through and, due diligence,
Changed all
they
the
changed
filters.
all the filters.
I do know they ended that on the public messages to get out and get some fresh air, but that's still causing a cause and effect. For example, last night,
right?
I had some search and rescue was out all last night, up out of Pine on more issues on the 22 road. As they were turning on the Cabin Lake Road, we got a call that another vehicle went past a stuck vehicle and they got stuck. We ended up rescuing 9 people.
Oh, jeez.
They did close Mount Hood, like you can't climb the mountain, so they're encouraging people to get out in the woods, but we're
For a
also
walk.
restricting the woods. But
Yeah,
it's not
do
for a
some
walk.
yard work.
Yeah,
So
we don't want, I'm not saying people need to like run out there and get lost and stuff. We're just talking like opening the windows.
Yeah.
You said we are
said,
lost in like.
You're right.
Well, yeah, I don't know.
We
I'm
don't need to have
thinking
more emergencies.
life is so busy, we're all so busy, it's gonna make us pause individually, not as a group, but individually pause, read the book, write the letter, watch the movie you haven't had time to, clean your house. I mean, we all have so much we don't have time to do.
Right.
This is a good time, even if you're not feeling quite, you might feel fine and just have a cough or a little fever and you're not gonna go to work.
Right.
You're still gonna be able to do stuff. Get those things done.
It's a good
You
time
know?
for county department heads to work on their budgets.
Right. I tell you, my house has never been cleaner.
It was
Oh, yeah.
uplifting until Brad said that.
Yeah.
I done that for our budget officer.
Yeah.
So Brad, do we need to make a decision on next week?
Well, by consensus.
By
the board is how we
consensus,
did
that's
last
the direction I'm pretty much open with, but it's the same for next week as it is this week.
Pretty much, we're extending it until next Friday at least.
Yeah, we tentatively, well, we'll have another meeting next Friday unless something happens. We're leaving the emergency, meeting open, we're allowed to do that, Melanie checked on that, so we just reconvene. And so you'll see unusual operations in this county.
What's that again?
We need to close it this Friday.
On Friday,
On Friday,
This is Friday.
so we can only have it open for about a limited period of time.
Yeah,
Okay.
okay.
But we could reopen an emergency meeting.
Yeah.
yeah.
Okay, so,
Was that from Jim?
Mhm.
Oh, okay, I missed that.
well, I believe we're be this afternoon when we'll oppose it, but.
Okay,
I
we'll
think
just do that later.
things are changing hour by hour.
Yep.
Thank you, everybody. I appreciate it. Oh, I'm sorry.
I did have one question for you, Darwin. I've had several phone calls of people wondering if they can still submit permits for things. I've got one guy.
For land use, they can still submit, and I will be getting to them as quickly as I can,
Okay.
as normal. It's good to hear we can do deposits. I'll probably have a group of those all want
Okay,
to bring in.
and how do they communicate with you via cell phone or?
Yeah, and I've changed
email?
my phone message to just send me an email, and I'll certainly have phone available for them as well.
Okay, sounds good.
Yeah, the 120-day clock, which some of you are aware of for land use, is being looked at to extend that. Or you can always have applicants waive it, but we've never even come close to the 120-day clock. But we did cancel March's planning commission, and there was only 2 applications. We've moved to April, but at this point, I'm going to be checking as things are moving, and hopefully we'll just do a video conference from this room, and also get Christmas Valley folks maybe in the community hall there. But we need to keep things moving, or it's just gonna continue to get backlogged.
Exactly.
Things will continue to slow, so I'm gonna do my best to keep things moving.
Just wanted to check in on you with that, so thank you. That was it for me.
All right, we'll recess at 22 minutes to 12. Thank you, everybody.